Welcome to Baby Care Month 3. Welcome back. This module focuses on the digestive health of your baby. Today, we will take time to understand an infant's digestive system, how it develops throughout the first year, and what impacts digestive development. We will review digestive concerns such as reflux, gas, diarrhea, food intolerances, and food allergies. Then, help you understand how to modify a baby's formula or the diet of a breastfeeding mother to reduce digestive distress to help your baby feel their best. This module will address the following topics and questions: digestive development throughout the first year of life, the importance of the microbiome, review research and potential benefits of probiotics, digestive concerns including reflux, gas, diarrhea, food intolerances, food allergies, and review how to modify infant formula or the diet of a breastfeeding mother to reduce or resolve adverse digestive symptoms. Digestive development throughout the first year. An infant's gastrointestinal tract is immature and develops rapidly throughout the first year of life. From birth to 5 months, the bacteria in the gastrointestinal tract is not very diverse. At 1 year of age, the microbiome or bacteria that live in the digestive tract become more complex and more closely resemble an adult. A healthy culture of bacteria in the gut will help support the immune system. Many factors affect the bacteria in the digestive tract, from genetics, antibiotic use, type of birth, and the composition of formula or human milk. Newer research suggests an infant's immune system and microbiome begin to develop during pregnancy and is referred to as immune priming. The placenta previously had been considered to be a barrier for the fetus. However, recent studies have shown that microbes colonize the amniotic fluid, the umbilical blood cord, and the placenta, suggesting that a maternal microbial colonization of the fetus may begin in utero. It is also hypothesized that these microbes play a role into the physiological development of the fetus. The next stage that directly affects which bacteria colonize the gastrointestinal tract is the type of birth. The microbiome of an infant born vaginally is more similar to their mother's and is primarily colonized with bifidobacterium and streptococcus, whereas the gut of an infant delivered by C-section shows significantly less resemblance to their mother's microbiome and has less bifidobacteria. Bifidobacteria have been shown to be the most represented bacteria in the gastrointestinal tract of healthy infants and positively influence inflammation, asthma, and immune tolerance related to allergies. After an infant is born, the microbiome is significantly impacted by the milk they drink. A mother's milk naturally contains prebiotics and probiotics, which positively impact the bacteria in the digestive tract. Prebiotics in breast milk are referred to as human milk oligosaccharides, HMOs, and encourage the growth of good bacteria in a baby's digestive tract. There are over 1,000 types of HMOs. The most abundant HMO in breast milk is 2-fucolactose. 2-FL is what we'll call it. 2-FL has been synthesized identically to the 2-FL found in human milk and is available in some formulas. Research has shown that infants fed with formula containing 2-FL HMO have immune benefits, fewer parent-reported respiratory infections, and improved formula tolerance. Ultimately, infant formula with 2-FL supports immune and gut health and is closer compositionally and functionally to human milk. Probiotics are good bacteria and in some cases have been shown to benefit health. However, they can be controversial because there are many different types or strains of probiotics, and each strain has a different effect in the body. Probiotics naturally occur in breast milk and can be found in probiotic supplements. Bifidobacterium longum infantis, or B. infantis, is a probiotic that is found in breast milk. The probiotic B. infantis helps digest prebiotics, HMOs, more completely than other organisms. This more complete digestion allows short-chain fatty acids to be released, which helps build a healthy gut. However, it is important to note, depending on the probiotic strain and if a prebiotic is not present, there is not always a benefit to the body. Digestive concerns and modifying infant formula or the diet of a breastfeeding mother. Note, for this section, please reference the Elimination Diet handout and chart. Digestive concerns with an infant can be overwhelming. We recommend working with your pediatrician and a dietitian to help identify the root cause of digestive symptoms. The following are dietary guidelines based on digestive symptoms present in an infant. To review your symptoms and create an individual plan, you can sign up to work with a NutriVantage registered dietitian. If an infant has symptoms that include gas, reflux, diarrhea, eczema, and mucus or blood in their stool, it is important to understand the underlying cause. Reviewing the infant's formula and/or the mother's diet to help identify if there are food intolerance or allergies that are causing these symptoms will be helpful. Another potential cause of digestive distress could be supplements. A baby may be sensitive to the iron, preservatives, or coloring in a vitamin or mineral supplement. Infant's main symptom, mild to moderate gas. If an infant has mild to moderate gas, it may be helpful to try gas drops. The active ingredient in gas drops is simethicone, which breaks up larger gas bubbles into smaller ones, which makes passing gas more comfortable for a baby. The American Academy of Pediatrics suggests that gas drops are safe to give to newborn babies and adverse side effects are rare. Do not give gas drops to infants taking thyroid hormone medication as simethicone can interact. Gripe water is believed to help soothe a baby's stomach and contains a variety of ingredients such as herbs, sugar, alcohol, and sodium bicarbonate. However, there is no evidence to support that gripe water soothes a baby's stomach or decreases gas. Additionally, if gripe water is used, it is important to limit how frequently, as too much sodium bicarbonate can lower the acidity in a person's blood and can lead to serious side effects. Infant's main symptom being reflux. It is important to first check how much your baby is eating and make sure they are not eating too much at one time, as this can cause reflux. Refer to handouts, Infant Feeding Guide, and How Much a Baby Should Eat, or refer to Month 1, Module 1, which discusses pace feeding, and Month 2, Module 2, which discusses nipple flow. For infant symptoms, excess gas, reflux and/or diarrhea, but the baby does not have eczema, mucus, or blood in their stool. If it is a formula-fed infant. For a formula-fed infant, switching from regular milk-based formula to a lactose-free formula is the mildest and first recommended dietary intervention. It may take up to 10 days to see if symptoms improve. For a breastfed infant, foods in the mother's diet that increase gas include cabbage, broccoli, beans, onion, Brussels sprouts, and cow's milk sugar, lactose. A breastfeeding mother should consider trying lactose-free milk and limiting gas-causing foods for 2 weeks to see if there is an improvement in her baby's symptoms. It may take up to 10 days to see if symptoms improve. Note: it is important to recognize the difference between lactose intolerance and a milk protein allergy. Reflux, gas, and diarrhea may cause a baby to not sleep well and be fussier, but these symptoms alone are not commonly associated with an allergy. Lactose intolerance is identified by a deficiency in lactase, the enzyme that breaks down milk sugar, and can cause loose stools. A food allergy is identified when the immune system overreacts to an allergen and produces antibodies called immunoglobulin E or IgE. Symptoms of a food allergy may cause hives, eczema, shortness of breath, abdominal pain, nausea, vomiting, or diarrhea. Appropriate testing should be performed by a doctor if a food allergy is suspected. Infant symptoms such as reflux, gas, diarrhea, along with eczema, mucus, or blood in their stool. If an infant's symptoms include reflux, gas, diarrhea, along with eczema, mucus, or blood in their stool, it is important to work with your baby's doctor. Food allergies should be ruled out first. If an infant has a negative test result for food allergies, a pediatrician may run a guac test to confirm the presence of blood in an infant's stool. If there are no allergies and an infant has severe eczema or blood in their stool, an elimination diet to test food tolerance or protein intolerance may be helpful. There is no specific diagnostic test to confirm protein intolerance. The diagnosis generally is determined once the suspected foods are removed from the infant's diet, symptoms resolve, and a reintroduction test confirms the food intolerance. An elimination diet to test for protein intolerance involves switching to an infant to dairy-free formula, or having the breastfeeding mother eliminate the top allergens one at a time. Protein intolerance most commonly occurs when the top allergen foods, dairy, soy, eggs, wheat, peanuts, tree nuts, fish, and shellfish. Fortunately, protein intolerance typically does not last beyond a child's 3rd year of life and often resolves as early as 10 or 12 months of age. For a formula-fed infant will need to try a dairy-free formula to see if symptoms improve or completely resolve. An elimination period is typically recommended to be 2 to 4 weeks, depending on severity of symptoms, and it may take up to 10 days to see if symptoms improve. If symptoms do not improve or resolve, it may be advised for a formula-fed infant to try a formula with partially hydrolyzed protein. Partially hydrolyzed protein formulas decrease the size of the cow's milk protein, making it easier to digest. It also potentially weakens the allergic symptoms from the proteins and sensitizes the allergen. For a breastfed infant, a breastfeeding mother is typically advised to first eliminate cow's milk from her diet to see if symptoms improve or completely resolve. An elimination period is typically recommended to be 2 to 4 weeks, depending on severity of symptoms, and it may take up to 10 days to see if symptoms improve. If symptoms do not improve or resolve from a mother eliminating cow's milk, it may be advised for the mother of a breastfed infant to test removing the top allergen foods, dairy, soy, eggs, wheat, peanuts, tree nuts, fish, and shellfish from her diet one at a time, or in extreme cases, all at one time, for 2 to 4 weeks to see if the infant's symptoms improve or resolve. After symptoms have resolved, a reintroduction period is essential to diagnose an intolerance or sensitivity. Without a reintroduction period, it is impossible to confirm whether the food or foods eliminated are responsible for improved symptoms. Additionally, it is important to make a diet as liberal as possible within the constraints of the elimination diet to ensure nutritional adequacy and maintain quality of life. As you try a few approaches to reduce digestive symptoms, you find what works best for you and your baby. If your baby is continuing to have digestive symptoms, please seek assistance. You can work with your pediatrician